Pap test, Satisfactory. Liquid-based Pap, 5,000 well-visualized squamous or squamous metaplastic cells, at least 2,000 in the following states: chemo, radiation, postmenopausal atrophic, post-hysterectomy. Thin prep, 50 cells at 10x, 3.1 cells at 40x. Sure path, 118 cells at 10x, 7.4 cells at 40x. Conventional Pap, 8,000 to 12,000 cells. Conventional anal Pap, 2,000 to 3,000 nucleated cells. Liquid anal Pap, sure path, 3 to 6 cells per high power field. Thin prep, 1 to 2 cells per high power field. Report if transformation zone is present. Transformation zone is defined as greater than 10 cervical or squamous metaplastic cells. If it is greater than 75% obscured, it is reported as unsatisfactory with a statement about obscuring factors. If it is 50 to 75% obscured, it is reported as partially obscured with a statement about obscuring factors. Pap test negative superficial squamous cell, seen in proliferative phase and in inflammation. Pycnotic nucleus, 10 to 15 square microns. Eosinophilic cytoplasm. May have keratohyalin granules. Pap test negative intermediate squamous cell. It is found in the middle layer, but found on the top in the secretory phase during pregnancy or high progesterone states. The nuclear size is a standard, 35 square microns. It has finely granular chromatin and may have a longitudinal nuclear groove. It is the naked nucleus of cytolysis. Pap test negative parabasal squamous cell, found in postmenopausal and postpartum status. Nucleus is 50 square microns. Pap test negative endocervical cell, columnar-shaped cells with honeycomb or picket fence formation. Nucleus is finely granular with small nucleoli. Cytoplasm vacuolated or granular. Nucleus at one end, mucus at other end. Pap test negative endometrial cell. Epithelial and stromal cells occur together as exodus, which is stromal cells surrounded by epithelial cells. Epithelial glandular cell nuclei are the same size as intermediate squamous cell nuclei, with high NC ratio, dense heterogeneous chromatin. Cytoplasm dense or vacuolated, may have apoptosis, may have small nucleoli. Report in patients 45 years of age and older. Pap test negative, lower uterine segment. Large cellular hypochromatic groups of glandular and stromal cells. Branching glands, surface gland openings, palisading nuclei in group interior. Stroma may contain small blood vessels, can protrude from surface in feathered or spindled pattern. You do not need to report lower uterine segment in patients 45 and older. Columnar glandular cells, round oval nuclei, coarse even chromatin, normal nuclear membranes. Pap test negative, squamous metaplasia. Size is similar to parabasal. Nucleus is around 50 square microns. May have spindle cytoplasmic projections. Associated with stimuli such as infection, inflammation, and trauma. Pap test negative, keratotic changes. Parakeratosis, small orangophilic or eosinophilic superficial cells with pycnotic nuclei. May be found singly or in sheets, whorls, or pearls. Shape is round to oval to polygonal to spindled. If nuclear enlargement hyperchromasia, irregular nuclear membranes, or 3D clusters are present, it is reported as ascus or above. Hyperkeratosis, anucleate polygonal superficial cells, may have keratohyalin granules, may have empty ghost nuclei. If there is lots of hyperkeratosis, be alert for neoplasia. Pap test negative, tubal metaplasia, columnar cells with cilia, terminal bars, goblet cells. Small groups, pseudostratified crowded groups. Nuclei round to oval, can be enlarged, pleomorphic, hyperchromatic. Even chromatin, NC ratio can be high. Cytoplasm can be vacuolated or have goblet cell changes. Usually no nucleoli, may have mitoses. Pap test negative, atrophy. Flat or monolayer sheets of parabasal-sized cells with little overlap or single parabasal-sized cells. Can have slight increase in NC ratio called atypia of atrophy, but no significant hyperchromasia or nuclear irregularity. Normal chromatic intermediate cells. Parabasal can have mild hyperchromasia and more elongated nuclei. Smooth nuclear membranes, uniform chromatin. May have autolysis, parakeratosis, and histiocytes. May have atrophic vaginitis, which is inflammation with a granular background similar to tumor diathesis. Pap test negative, decidual cells. These are pregnancy cells from endocervical or endometrial stroma. Single cells or small clusters. Cytoplasm is abundant to granular to finely vacuolated and may have cytoplasmic processes. Nuclei are 35 to 50 square microns. May be lobulated or multinucleated. Chromatin is fine and evenly distributed. May be normochromatic or hyperchromatic. Smooth nuclear membranes, prominent basophilic nucleoli. Cells are larger than squamous interepithelial lesion. Fine chromatin and nucleoli show that they are benign. Pap test negative, trophoblast. These cells are present during or after pregnancy. Cytotrophoblast, single or small clusters, small cells with enlarged nuclei, have high NC ratio, hyperchromasia, even chromatin, may have vacuoles, may have inflamed or bloody background. Syncytiotrophoblast, large multinucleated cells, up to 50 or more nuclei, normochromatic, even chromatin, may have irregular nuclear membranes. Granular cytoplasm tapers at one end of cell. Fine chromatin and nucleoli show that cells are benign. Pap test negative, Arias-Stella reaction. These are glandular cells associated with pregnancy or high progesterone states. Single cells or clusters of glandular cells. Variable amount of cytoplasm, may have vacuoles. NC ratio is variable and may be high. Nuclei are large, hypochromatic, with irregular contours such as grooves or pseudo-inclusions, granular to smudgy chromatin, multiple and prominent nucleoli. Background is inflammatory and may have leucophagocytosis. Pap test negative, reactive or repair changes. Nuclear enlargement, more in endocervical cells, sometimes bi or multinucleation. Smooth, round nuclear membranes. May have vesicular hypochromatic chromatin. May have mild hyperchromasia. May have single or multiple nucleoli. Clear cytoplasm boundaries, may have polychromasia, vacuolization, perinuclear halos but not coilocyte halo. often in cohesive, streaming school of fish sheet or with taffy pull cytoplasmic processes. If there is anisonucleosis, irregular chromatin, irregular nuclear membranes, or variation in size and shape of nucleoli, it is reported as ASC-US or above. Pap test negative follicular cervicitis, polymorphous population of lymphocytes. Tingible body macrophages may be present. Pap test negative radiation, very increased cell size but NC ratio is maintained. May have bizarre shapes. May have cytoplasmic polychromasia. Nuclei can vary in size. Cell group can have normal and enlarged nuclei. May have nuclear degeneration such as nuclear pallor, wrinkling, smudging of chromatin, nuclear vacuolization. May have mild nuclear hyperchromasia. Pap test negative, IUD changes. Single glandular cells or clusters of 5 to 15 glandular cells in a clean background. Variable cytoplasm may have large signet ring vacuoles. May have few single cells with larger nucleus and high NC ratio. May have nuclear degeneration such as wrinkled chromatin or cracking. May have prominent nucleoli, psammoma bodies, or actinomyces. A quarter of the time with IUDs, actinomyces is present. Pap test negative organisms. The following organisms are reported on Pap tests. Trichomonas vaginalis, fungal organisms morphologically consistent with Candida species. Shift in flora suggestive of bacterial vaginosis. Bacteria morphologically consistent with actinomyces. Cellular changes consistent with herpes simplex virus. Cellular changes consistent with cytomegalovirus. Pap test ASC-US. Atypical squamous cells of undetermined significance. Nuclei 2.5 to 3 times the size of intermediate squamous nucleus, or 2 times the size of a squamous metaplastic nucleus. Slightly increased NC ratio. Minimal nuclear hyperchromasia and irregularity in chromatin distribution or nuclear shape. Atypical parakeratosis, nuclear abnormalities associated with dense orangophilic cytoplasm. Incomplete coilocytosis, cytoplasmic changes suggestive of HPV effect, resembling coilocytes but absent to minimal nuclear changes. Pap test, ASC-H, atypical squamous cells cannot rule out HSIL. Single cells or small groups of less than 10 cells may stream in mucus on conventional smear. Cells the size of metaplastic cells but with nuclei 1.5 to 2.5 normal size of metaplastic cells nuclei. NC ratio is close to that of HSIL. Hyperchromatic crowded groups with nuclear pleomorphism, loss of cohesion, nuclear overlapping. Colposcopy is recommended for ASC-H. Pap test, low SIL, low-grade squamous interepithelial lesion. Single cells, clusters, sheets of intermediate or superficial cells. Nucleus more than 3 times the normal intermediate cell nucleus size, resulting in slight increase in NC ratio. Nuclei usually hyperchromatic, maybe normochromatic. Variation in nuclear size, bi- and multinucleation is common. Uniform chromatin, coarsely granular, smudgy, densely opaque. Variable nuclear membrane from smooth to irregular notches. Nucleoli absent or inconspicuous. Cells may show increased dense eosinophilic keratin or classic coilocyte halo, but must also show nuclear abnormalities. Pap test, HSIL, high-grade squamous interepithelial lesion. Single cells, sheets, syncytial groups, hyperchromatic groups. Smaller, less mature cells than low SIL, often basal size. More variation in nuclear enlargement than low SIL. Can be same size as low SIL or normal intermediate nucleus size. Higher NC ratio than low SIL. Nuclei usually hyperchromatic, can be normo or hypochromatic. Chromatin evenly distributed, finely to coarsely granular. Irregular nuclear membranes, often prominent indentations or grooves. Nucleoli usually absent, can be seen in repair or endocervical gland spaces. Variable cytoplasm, immature, lacy, metaplastic, keratinized. Pap test, keratinizing squamous cell carcinoma. More single cells, variation in cell size and shape, tailed or spindle cells, orangophilic cytoplasm. Anisonucleosis, irregular nuclear membranes, dense opaque nuclei, or coarse irregular chromatin with clearing. May have macronucleoli, but less than in non-keratinizing squamous carcinoma. May have hyperkeratosis or parakeratosis, but must have nuclear features to be called squamous carcinoma. May have tumor diathesis, but less than in non-keratinizing squamous carcinoma. Pap test, non-keratinizing squamous cell carcinoma. Single cells or syncytial aggregates. Cells may be smaller than HSIL, but with HSIL features. Nuclei with irregularly distributed and coarsely clumped chromatin with clearing. May have prominent nucleoli. Often has accompanying tumor diathesis. In liquid-based PAPs, cell rounding may make the cells appear glandular, and diathesis may be more subtle and cling to the edge of cell groups. Pap test, atypical endocervical cells, NOS, not otherwise specified. Cells in sheets or strips with some cell crowding, nuclear overlap, or pseudostratification. Nucleus enlarged 3 to 5 times. Some variation in nuclear size or shape. Mild nuclear hyperchromasia, mildly irregular chromatin. Occasional nucleoli. Rare mitoses. Abundant cytoplasm but increased NC ratio. Often distinct cell borders. Liquid PAPs. Groups more rounded, more 3D, with piled up layers of cells. Pap test, atypical endocervical cells favor neoplastic. Abnormal cells in sheets or strips with nuclear crowding, overlap, or pseudostratification. Rare groups with rosettes or feathering. Enlarged to elongated nuclei with some hyperchromasia. Coarse, heterogeneous chromatin. May have mitoses, may have apoptoses. Increased NC ratio. Cell borders may be ill-defined. In liquid-based PAPs, groups may be three-dimensional, densely packed, with layers obscuring nuclear detail. Pap test, atypical endometrial cells. Cells in small groups, often 5 to 10 cells. Nuclei slightly enlarged. Mild hyperchromasia. Heterogeneous chromatin. Occasional small nucleoli. Scant cytoplasm, sometimes vacuolated. Ill-defined cell borders. In liquid-based PAPs, nuclear hyperchromasia and nucleoli can be more prominent. Pap test, Endocervical Adenocarcinoma in Situ, AIS. Cells in sheets or clusters with pseudostratified or rosette patterns, nuclear crowding, overlap, loss of honeycomb, and single cells are rare. Some Cells are columnar-shaped. Palisading clusters and feathering, with nuclei and cytoplasmic tags protruding from periphery. Enlarged nuclei, anisonucleosis, and oval to elongated nuclei. Hyperchromasia, evenly distributed coarsely granular chromatin. Nucleoli are small or inconspicuous. Mitoses and apoptoses are common. NC ratio is increased, with less cytoplasm and mucin. Usually no diathesis, may have inflammatory debris. In liquid paps, nucleoli are more visible and chromatin may be fine. Pap test, Endocervical Adenocarcinoma. Many abnormal cells, usually columnar. Single cells, sheets, clusters, syncytial groups. Enlarged pleomorphic nuclei, irregular chromatin, chromatin clearing, irregular nuclear membranes. Macronucleoli, finely vacuolated cytoplasm, often has necrotic diathesis, may have abnormal squamous cells. Pap test, Endometrial Adenocarcinoma. Single cells are small, tight clusters. Nuclei vary from slightly to very enlarged. Anisonucleosis and loss of polarity. Moderate hyperchromasia, irregular chromatin distribution, and clearing. Small to large nucleoli. Cytoplasm usually scant, cyanophilic, vacuolated. Cells or groups may show intercytoplasmic neutrophils, nicknamed bag of polys. May have finely granular or watery diathesis. In liquid-based paps, 3D or papillary groups are more common. Nuclei are larger with fine chromatin and there is less diathesis.